What if I told you that a single pill, one that was designed for just one disease, ended up becoming this revolutionary treatment for two others? It sounds kind of wild, right? Well, that is the incredible, true story of dapagliflozin. This is a drug that didn't just bend the rules, it completely rewrote them for treating diabetes, heart failure, and kidney disease.
I mean, just think about it for a second. What if there was one pill that could do more than just manage your blood sugar? What if it could also actively protect your heart and your kidneys? And here's the kicker. Even if you don't have diabetes. For a long, long time, that kind of thing sounded like pure science fiction. But it's not. It's the very real story of the drug we're diving into today. Okay, so to really get why this drug is such a big deal, you gotta understand a little bit of history. For decades, decades, when we talked about treating diabetes, everything, and I mean everything, revolved around one main thing: insulin. But dapagliflozin, it just completely broke that mold. It found a totally new way to tackle a very old problem.
So the drug's official name is dapagliflozin, and it belongs to this group of drugs called SGLT2 inhibitors. Now, that's a mouthful, I know. It stands for sodium glucose Cotransporter-2 inhibitor. But don't let the name scare you. The secret to its magic is right there. It's all about inhibiting, or, blocking, a very specific protein in our bodies.
And this right here is the absolute game changer. You see, most treatments were all about trying to make the body produce more insulin, or maybe use its own insulin better. But dapagliflozin, its whole method of action is completely 100% independent of that system. It found a brand new, kind of genius way to get the job done. So the big question is, how does it actually work? Well, I like to think of it as the kidney exit strategy. And the idea behind it is just so clever. Instead of trying to force the body to deal with all this extra sugar, the drug just asks a simple question. Why not just help the body get rid of it?
Okay, here's what's normally happening inside you. Your kidneys are constantly filtering sugar out of your blood. But there are these little proteins, the SGLT2 proteins, and they act like super efficient gatekeepers. Their job is to grab about 90% of that sugar and pull it right back into your body. So what does dapagliflozin do? It just steps in and blocks those gatekeepers. It basically tells them, nope, not today. You're letting that sugar pass right on through. So the whole process is really straightforward. Step 1, your blood gets filtered. Step 2, those SGL2 proteins try to do their job and grab the sugar. But step 3, dapagliflozin is right there blocking them. And the result is beautifully simple. That extra sugar has nowhere else to go but out of your body when you pee. And what does this mean in the real world? Well, it leads to a drop in your HbA1c levels. That's the key number doctors look at for long-term blood sugar control. We're talking a reduction of about 0.5% to a full 1%. Now, that might not sound like a huge number, but trust me, for anyone who's managing type 2 diabetes, that is a really, really big deal. But wait, there's more. The story doesn't stop with just blood sugar. When you get rid of sugar, you're also getting rid of its calories, right? So that often leads to a little bit of weight loss. And get this, sugar likes to pull water along with it. So the drug also acts as a mild diuretic, which, along with helping you get rid of some sodium, can help lower your blood pressure. These aren't just random side effects. They're all these fantastic beneficial ripple effects from that one core action. And this is where the story gets really, really interesting, because researchers started to notice something. This drug was doing way more than just controlling blood sugar. It was having this completely unexpected and incredibly positive effect on the rest of the body. This discovery was so huge that it wasn't just the diabetes doctors who were sitting up and taking notice. Suddenly, cardiologists, heart specialists were calling it a major breakthrough in cardiology. I mean, just let that sink in for a second. A drug made for diabetes was suddenly the talk of the town among heart doctors. That's crazy. And this wasn't just hype, It led to real, official approvals. So today, dapagliflozin isn't just a drug for type 2 diabetes anymore. Nope. It's now a go-to frontline treatment for heart failure, and it's also used to help slow down chronic kidney disease. Okay, but here it is. This is the part that changed everything. The protective benefits for the heart and the kidneys, they work even if a person doesn't have diabetes. That one discovery, right there, was the moment dapagliflozin went from being a diabetes drug to being this essential, life-changing therapy for millions and millions of other people. All right, now, it's really important that we're balanced here. With any medication this powerful, you have to look at the other side of the coin. The benefits are amazing for sure, but it's absolutely crucial to have a clear picture and understand the real, documented risks that come with it. So let's break it down. On the pro side, it's pretty clear. You get lower blood sugar, a little weight loss, and of course that incredible protection for your heart and kidneys. Now for the cons. Because you're getting rid of more sugar through urine, there is a higher risk of getting genital or urinary tract infections. And that diuretic effect we talked about, it can sometimes lead to dehydration. Plus, there are some rare but very serious risks, like something called ketoacidosis, which is a dangerous buildup of acid in your blood. Now, this risk isn't the same for everybody. Certain groups of people need to be a bit more careful. We're talking about the elderly, people who are already on other diuretics, water pills, and anyone who has a history of these kinds of infections. For these folks, it's really important that their doctor monitors them closely. And we have to be completely upfront about the most serious, though very rare, risks. There's a condition called Fournier's gangrene, which is a really aggressive infection. It is a true medical emergency. Now, let me be clear, the risk is extremely low, but being fully aware is just so important for patient safety. So, when you take a step back and look at the whole picture, what's the big takeaway here? What's the legacy of a drug like this? Well, it's not just another new pill on the shelf. It has literally redefined the entire standard of care for some of the biggest, most interconnected diseases out there. Experts use a powerful phrase to describe its impact. They call it a paradigm shift. And that's a big deal. It means this drug didn't just make small improvements on the old way of doing things. No, it created a totally new way of thinking about how to manage these complicated conditions together. What it all boils down to is a much more holistic approach to medicine. Doctors aren't just looking at a single number on a lab report anymore, like just the blood sugar. They're treating the whole patient, the heart, the kidneys, the entire system. And they can often do it with one single powerful pill. And that leaves us with a really fascinating question to think about, doesn't it? The success of dapagliflozin proves that so many diseases we used to think of as totally separate, well, it turns out they're deeply connected. So it makes you wonder, what's the next domino to fall? What other complex health problems are out there, just waiting for us to find that one simple, elegant key that unlocks the whole puzzle?